The ban on evictions put into place during the height of the pandemic expires. How to get help if you need it. But first, experts say Michigan is at a, quote, COVID precipice as the Delta variant continues to spread. How to keep yourself and your family safe as we navigate the uptick in cases. Good afternoon, everybody, and that tops our news here at noon. I'm Karen Drew. Medical experts at Beaumont Health just held a briefing and talked about what they're experiencing at the hospitals. Let's get right to our Paula Tutman for a closer look. Paula.
Yeah, hi, Karen. Good afternoon, everyone. I need to tell you, this was a very alarming news conference. We heard from Dr. Joel Fishbane, and he's the medical director for infectious prevention at Beaumont Grosse Pointe. And he says currently in the Beaumont group, there are 64 patients hospitalized with COVID. 61 of them are uninoculated. They've not gotten any vaccination. Another 3 have gotten the vaccine and the virus broke through. Still need to unpack some information. He didn't have a lot of information on when they got their vaccines or whether or not they had any pre-existing conditions. That would be important to know. He didn't have that information, but suffice to say that 3 of the 61 have been vaccinated. He also talked about the rate of spread with this Delta variant and how it also behaves differently than the original virus. So the virus has replicated itself in order to survive, and what it's replicated itself into is something that we really haven't seen before. In other words, it's more aggressive, it's more easily transmitted. It hides itself in our nasal passages, and so even people who are fully vaccinated, they will have viral load inside their nasal passages, and they're actually able to spread it, the science shows, to people who are unvaccinated. And because there are so many people out there who are still unvaccinated, unwilling to get vaccinated, what he says is this Delta variant is giving the Delta variant is having an opportunity to replicate itself into something no current vaccine will actually be able to fight. And Karen, this was the most chilling. In his words, he says he sees potential disaster on the horizon.
I'm concerned that the next variant might escape previous immunity and might escape vaccination. That's why we have to vaccinate everybody as quickly as we can, try to prevent any transmission. And I think individuals should probably consider going back to universal masking when they're going to stores or when they're gathering in large groups indoors.
Yeah, and he also talked about children in schools and the fact that they need to mask up as well. I asked him if there was any medical condition out there that precludes anyone from safely getting the vaccine, fertility fears, pregnancy, pre-existing conditions. And he said anything other than an allergic reaction for something inside the actual vaccine, because remember, this isn't live vaccine, but anything other than an allergic reaction to something used in the processing of the vaccine, that would be the only reason to not get a vaccination. And again, he said, just because there is no mask mandate, that is not a reason to not wear a mask. He believes all of us, vaccinated or not, and children should go back to regular masking, particularly inside indoor places. Karen, lots to unpack. I'll have more at 4 o'clock and 5 o'clock as well.
All right, we appreciate it. Thank you very much, Paula.